Welcome back friends to Join Academy. This video is going to be on the diagnosis and management of diabetes. Diabetes is simply diagnosed by healthcare providers checking the blood glucose level. 3 tests can be employed to measure the blood glucose level. These tests are fasting blood glucose test, random blood glucose test, and A1C. For fasting blood glucose test, you don't eat anything except water for at least 8 hours before the test. What fasting blood glucose test does is that it allows the healthcare provider to see the baseline of the blood sugar. As for random blood glucose test, what it means is that you can actually carry out this test at any time, regardless if you have fasted or not. As for A1C, it provides the average blood glucose level for the past 2 or 3 months. It is also called the glycated hemoglobin test or hemoglobin A1C test. Gestational diabetes is diagnosed or screened through oral glucose tolerance test. What this test does is that it shows if you have diabetes or if you don't have diabetes or if you have pre-diabetes. The values gotten from this test may vary slightly, so the healthcare provider rely more than this test for them to be able to diagnose diabetes. The following are the different test values for each test. For fasting blood glucose test, it is in range when the value is less than 100 mg per dl. Then it is in prediabetes when the value is between 100 to 125 mg per dl. And it is diabetes when the value is about 126 mg per dl or higher. As for random blood glucose test, it is in diabetes when the value is about 200 mg per liter or higher. Then as for A1C test, it is in range when the value is less than 5.7%. Then it is prediabetes when the value is about 5.7 to 6.4%. Then it is diabetes when the value is 6.5% or higher. Let's look at how diabetes can be managed. Diabetes is a complex condition, so its management involves several strategies. It's a complex disease that affects everyone differently, so the management plans are highly individualized. The major aspects of managing diabetes include blood glucose monitoring, oral diabetes medications, insulin, diet, and exercise. Monitoring the blood glucose level is the major key for determining how well the current treatment plan of a particular individual is working. It provides the information on how to manage diabetes on daily and sometimes on hourly basis. Glucometer can be employed to monitor the level of glucose level. Oral diabetes medication help in management of blood glucose level in people that have diabetes but still have the ability to produce some insulin, mainly people with type 2 diabetes and prediabetes. People with gestational diabetes may also need oral medication. People with type 1 diabetes need to inject synthetic insulin to live and manage diabetes. Some people with type 2 diabetes also require insulin. There are several different types of synthetic insulin. They each start to work at different speeds and last in the body for different lengths of time. The 4 main ways insulin can be taken include injectable insulin with syringe, insulin pens, insulin pumps, and rapid-acting inhaled insulin. Meal planning and choosing a healthy diet for an individual with diabetes are key aspects of diabetes management, as food greatly impacts blood glucose level. Healthy eating habits can also help manage weight and also reduce the risk of heart attack. Physical activity increases insulin sensitivity and also reduces insulin resistance. So regular exercise is an important part of management of all people with diabetes. Due to increased risk of heart disease, it is also important to maintain a healthy weight, blood pressure, and also cholesterol level. How can one prevent diabetes, you might ask? You can't actually prevent autoimmune and genetic form of diabetes, but there are some steps one can take to lower the risk of developing prediabetes, type 2 diabetes, and also gestational diabetes. Some of the steps include eating a healthy diet, getting physically active, working to achieve a weight that is healthy for you, stress management, limit the intake of alcohol, quit smoking, take medications as directed by your healthcare provider. When can one see a healthcare provider? If you haven't been diagnosed of diabetes, it is important to see a healthcare provider if you have any of the symptoms of diabetes, such as increased thirst and frequent urination. If one has diabetes, you should also see your healthcare provider to help in the management of the diabetes. Thank you so much for your time. We'll see you in the next video.